higher strength vitamin D, who might benefit, and staying safe. This video is for general educational purposes only and is not a substitute for medical advice. Please speak to your GP, pharmacist, or healthcare professional before making any changes to your supplements. Is a higher strength vitamin D supplement right for you? Or could it actually cause harm? That's exactly what we're covering today. Vitamin D deficiency is surprisingly common in the UK, especially during autumn and winter when sunlight is limited. Most people are familiar with the standard low-dose supplement recommended for general use, but higher strength options are widely available, and it's worth understanding who they're actually intended for. So let's start with the basics. Vitamin D is a fat-soluble vitamin that helps your body absorb calcium and phosphate, keeping your bones strong. It also supports your immune system and plays a role in muscle function. The UK government recommends a standard low-dose supplement for general use during autumn and winter. Higher strength vitamin D is a step up from that, a moderate dose used to maintain adequate levels or correct insufficiency in people who need more support. Most higher strength supplements contain vitamin D3, the same form your skin produces naturally in sunlight. Research suggests it's generally more effective at raising your vitamin D levels than vitamin D2. Once you take it, your liver and kidneys convert it into the active form your body can use, supporting bone health and other important functions. So who might benefit from a higher strength supplement rather than the standard dose? The evidence points to several groups. People with limited sun exposure, whether due to working indoors, covering their skin, or being housebound. People with darker skin tones, as higher melanin levels mean less vitamin D is produced from the same amount of sunlight. Those with malabsorption conditions such as Crohn's disease or celiac disease. People living with obesity, and those who've previously been diagnosed with vitamin D deficiency or insufficiency. If you fall into any of these categories, a higher strength supplement may be more appropriate. But that's a conversation to have with your doctor, not a decision to make on your own. The evidence is strongest for bone health and correcting vitamin D insufficiency. Research is also exploring vitamin D's potential roles in immune, cardiovascular, and metabolic health, though those areas are still developing. In terms of safety, higher strength vitamin D is generally considered safe for adults when used appropriately, but it's not without risk. Taking too much vitamin D over a prolonged period can lead to hypercalcemia, where calcium levels in the blood become too high. There are also specific situations where medical advice is essential before starting. If you have hypercalcemia, kidney disease, or sarcoidosis, supplementing at a higher strength without supervision could be harmful. If you take certain medications, including digoxin or thiazide diuretics, there are potential interactions to be aware of. And importantly, do not give higher strength vitamin D products to children unless a clinician has specifically advised it. When it comes to taking any vitamin D supplement, always follow the guidance of your GP or pharmacist on how and when to take it. If you experience any concerning symptoms while taking vitamin D, contact your doctor promptly. To recap, higher strength vitamin D may be appropriate for people at greater risk of deficiency, but the standard low-dose recommendation applies to most people for general use. Certain health conditions and medications make medical advice essential before starting, and higher strength products should never be given to children without clinical guidance. This video is general information only, not personal medical advice. Please speak to your GP or pharmacist before changing your supplement routine. Everyone's needs are different, and personalised advice is always the safest route. Have you ever had your vitamin D levels tested? Let us know in the comments. If you found this helpful, give it a like and subscribe to the Bolt Pharmacy channel for more evidence-based health content.